Hi guys, welcome back. Let's start the forensic medicine lectures. This is the first day for the episode 1 in which I'm going to see forensic medicine is a two parts. The forensic medicine part is there and toxicology is there, and there is so much of subdivision over there. So let's take it this way so we will understand more. Let's start with the forensic medicine changes. So you can understand that, especially for the NEET PG, FMG or the NACT examination. The most important questions they're asking from the postmortem changes. So let's take from that, and I want you to understand it in the simplest manner. So everyone should understand that even without a medical knowledge, they should understand the key terms. That's the purpose of this video. That's what I'm thinking. So just forensic medicine, if you take the term, it will be like the forensic medicine is a branch of medicine. Hope you know that. So in which that deals with the application level of medical and paramedical knowledge into the administration level of a law or a judicial thing. So simply saying, the forensic medicine that gives solution for the legal issues, for the murder, for the injuries, or whatever thing. So it's an aspect of it's a medical aspects of law. Hope you understand the terms, right? So that is a forensic medicine. Toxicology part is there. It deals with the poisons, CNS poisons there, cardiac, spine, organic, inorganic metal, or fish poisoning is there. Then our agricultural poison is there. So much of deal all with the poisonous part, food poison, and everything we are dealing with in toxicology. So that's a simple part, and we can take it at the end of the sections. Maybe at the last sections of this episode we'll take that poisonous part, which is not that important when it comes to the first part. Okay, so let's take the first part, postmortem changes. So for the postmortem changes, two things you need to understand. One is the forensic autonomy, and second is the suspended animation. So forensic autonomy, it is the interdisciplinary study and the interpretation of the process of postmortem changes in the dispositional context. Okay, it's a definition of forensic autonomy. So when you take that in a simple manner, that is the what are the changes which is occurring after the onset of death. What will happen immediately after death, what will happen in the early, and what will happen in the late. So there is a order there, that is a immediate, that means a somatic, what are the changes will happen. And then in the cellular part, what are in the early changes, what are the early changes we can appreciate in the dead body, what are the things we can change in the late, in the decomposition position, and the decomposition part. So these are all we deal in the forensic autonomy. Okay, so let's take the immediate or somatic death part, that is with insensibility of the loss of voluntary power. That is the first thing. And then cessation of respiration, the cessation of circulation. These three things are the part of immediate effect. And then what about the early changes which you need to understand in the death? That is a cellular death, in which you need to understand that the pallor, loss of elasticity of the skin, and changes in the eye, tachynoid, or the primary flaccidity of muscle, cooling of the body, that is Algor Mortis, or the postmortem lividity, lever mortis, or and the rigor mortis part, the flaccidity of stiffening of the cadaveric stiffening, we call it rigor mortis. And for the late changes, or the decomposition part, or the decay part, that is the mummification, adipocere formation, and putrefaction. So these all things we need to understand in order of appearance, like so let's take the suspended animation or apparent death, in which you cannot find the signs of life, but for the some minutes to half an hour. So what will happen, that person is totally alive, but he cannot control his voluntary or involuntary, he can control his vitals. So as a doctor, when you go and check, you cannot appreciate the signs of life, but he's alive. That's the suspended animation or the apparent death. The two places you can see it voluntarily, you can do it by the yoga practitioners, great sannyasis over there who can do it. Even the monk can do it, the Buddhists can do that. Personally, when one place where they are talking about that in different level. I don't want to talk about that. So secondarily, involuntarily, there is so much of disease there which may lead to such a thing, because like vehicle inhibition, severe synochial attacks, the newborn infant will show this, drowning, electrocution, sunstroke, cholera, some narcotic poisoning, and after even anesthesia, shock, hypothermia, cerebral concussion, insanity patients. So these patients, what happen? These people will stop their life for some time and they will regain that life. So you need to understand the term, you need to understand this is usually you should know this phenomenon. That's it. And also one more thing is that there is a superstar movie in Tamil Nadu used this suspended animation, apparent death. Can you name it? If you can name it, you will get a heart. So hope you understand the forensic taxonomy and that order of appearance of science, in which we need to understand each one, especially in terms of rigor mortis, liber mortis, and algor mortis, because these three are the most important question in terms of forensic medicine in all questions. Doesn't matter that for the university or the central institutions or the entrance examination, it's most important. They will ask one of these questions for sure. So we need to understand in the depth of that manner. So we take that into the depth. So it's the most Algor mortis, or the cooling of the body. How, what happened to the body immediately after death, and what will the changes will happen after the hours. So we will see in detail. Okay, that is the first part is the Algor mortis. You need to understand Algor mortis is the cooling of the body. That you need to understand that term. The terminology is very important, as we're going to ask you many questions. So please answer. So what will happen immediately? The death occurred, and immediately the temperature of the body will not go sudden. So there is no sudden decrease in the body temperature. It will take some time, because the first thing that heat is generating by the dying tissue by glycogenolysis, and by the our gut microflora, that is our gut bacteria start decaying our body. The decomposition process starts, so that lead to maintain the temperature as before the death occurred. So there is some kind of temperature remain for some time. After so quite some time, so 0 minute to half an hour, then what happened? The decrease of temperature will happen to the body to some extent, because of the bacterial activity. The body temperature will not reach the ambient temperature. So what will happen? Till to some temperature to 4 degrees Celsius, the temperature will cool down, and then there will be plateau phase will happen, because our bacteria, intestinal bacteria, will start their process of decomposition, in which body will generate the temperature. So the rate of cooling will depend on the body, depend on the medium. So average we can say 0.4, 0.6 degrees Celsius, or up to 1 degree Celsius. It totally depending on the medium, totally depending on the body. So that's it. So at the end, when you taking a graph, that will be a S-shaped curve. You can get it an isothermic phase, then a linear decrease, and then again a plateau phase will happen. It's totally depend. Okay, when you put the bodies on the freezer, then it will not happen. Then there will be the process will slow down. Okay, then let's take the there is a formula there to estimate the time since death from the cooling. Again, I'm telling you that it is not universal, it is totally subjective. So the thing is like normal body temperature minus rectal temperature by the rate of temperature fall per hour. Through that, we can estimate the time since death. We can appreciate that it happened this much hours back. So we can estimate the time from that. Okay, so for that you need to understand how we measure the temperature. So how we measure the temperature in the dead body? We take the long lab thermometer, which is having we can measure from 0 degree to 50 degrees Celsius, and we put that in the rectum for 10 to 12 centimeter for 2 minutes. It is not an ideal place. There is some other places like subhepatic phase is there, that we are taking an incision and go to the peritoneal cavity, and then we put the thermometer under the surface of liver, then leave for 2 minutes, and we record it. And the thing is that we need to record in interval between 1 or 2 hours, so that we can get the falling temperature. And also some other places like our on our external auditory meatus, and also to our nose till to the cribriform plate, we have to put the thermometer and leave for 2 minutes, and we have to count it again after 1 hour. In this way, we can get the temperature, we can get the fall of temperature. At the end of this section, I will give you a problem in which you can comment the answer, how much it is. So through that, we can understand it. And one more thing is that it is not universal. It is totally subjective. We don't know that what happened. Even with some thick clothes, that will take, the process will be slowed down, because clothes and other material have the obstructive properties there. That means the heat loss will be slowed down, so the cooling will be, it take time more. So for average person, the naked person, it take around 50 to 20 hours to reach the room temperature. The cooling down will take around 50 to 20 hours. That is the an average time. It totally depends. We cannot appreciate, we cannot tell in a universally. There is no universal method of estimating the time since death so far. So what are the factors affecting the cool? So far you understand about the things. So I hope you can make your own, through your common sense, you can write, you can tell about the fact, what are the factors affecting the cooling of body. See, one is the things with the body, second is the medium. So for the environment part, you know that air, when the body is on the flowing water, that will be the fastest way of cooling. When it is in the still water, it will like 2 times faster than air. That you need to understand. And if the water contains sewage and all, then the cooling power will be slowed down. Okay, and then the first part you understand about the medium, and then for the medium part you need to understand, in tropical climates, that means that the heat loss will be roughly 0.4 to 0.6 degrees Celsius, and for the temperate places 1 degree per hour there will be decrease will happen. And the build of the cadaver, that is very important. If the person is like young and old, children and old people are more rapidly than adults, because of the weight of the body to the surface area. The proportion of loss will be uh, lower. That's some proportional there. The weight is to surface area. And then the second is that the physique of the cadaver. Hope you know that fat is the bad conductor of heat. What happen if you have more fat? The process will slow down. If it's thin, then the process will get fast. So, and then the last is the environment part. That's what I said in the first part, because the cooling still water will be twice as fast as air, and in the flowing water, that is 3 times more fast than the air. So hope you understand everything about the Algor Mortis. And one more thing is the postpartum caloricity, which means the body temperature will increase for the first 2 hours of the death. Why it is happened? Because when the regulation of heat production has been severely disturbed before death. What are the case? You can assume that it is not that big. When the patient on sunstroke and some nervous disorder, and when there has been a great increase in heat production of the muscle due to convulsions, and the tetanus or the strychnine poisoning, and when there has been excessive active activity, that is like septicemia condition, cholera, and some other fever condition, you can see that is postmortem caloricity. Okay, and when you're taking the rectal temperature, there is a variation there because of the many reasons. Even the morning the temperature will be low, and the evening the temperature will be more, and the individual variation is also there. So it cannot be assumed that the body temperature is in the normal at the death. In some cases, like fat embolism, air embolism, certain infections, septicemia, heat stroke, spontaneous hemorrhage, thyrotoxicosis, psychotropic emotional stress, administration of neuroleptic medication, carbon monoxide poisoning, and the intoxication with the heroin and cocaine, and the drug interaction, there's a sharp rise in the temperature will occur. Okay, and in some cases, death temperature up to 1.5 to 2 degrees Celsius low in such cases like collapse, congestive cardiac failure, hypothermia, hypothyroidism, administration of muscle relaxant, cholera, secondary attack. So you need to understand these factors to estimate the rectal temperature. There's a variation there. You should understand that.
Here is a sample question for you guys. That is, the first 12 hours, the body loses around 0.78 degrees Celsius per hour. After first 12 hours, the body loses about 0.39 degrees Celsius. So the normal temperature is about 37 degrees Celsius. So following two questions out there, actually three questions out there. So please, if you can, please comment down your answers. If you are right, you will get gifts. That's it. So hope you understand everything about the Algor Mortis, and let's take the another chapter, Rigor Mortis on the next chapter. So on the next episode, please stay tuned, guys. I hope you understand that. Any question you have, please comment on that. Or any mistake happened during the lecture, please excuse. You can point out. We can study together. So that's it. Thank you, guys. Thank you so much.